Now you're good to go.
All right, thanks, Heather. Good morning, everyone. We'll call this meeting of the Long-Term Care Committee of Management to order on September 14th at 9:30. Just remind the elected members of their obligation to declare a pecuniary interest or an interest. Seeing nothing, if anything should arise, you may declare it at that time. We have long-term care report LTCRCM 1921 regarding the long-term care COVID-19 status update we received for information. Can I have a mover, please, for that? Moved by member Burley and seconded by member Robinson. Jennifer, are you starting us off with this one?
I am. Thank you, Chair Mackey.
The floor is yours.
Thank you. Good morning, committee. So this is a fairly lengthy report. I'm going to hit the highlights. A lot of things happened in the last 2 months in terms of COVID and long-term care. So there were several directive updates over the summer that led us through stage 2 and into stage 3 reopening. We held a couple of virtual family meetings to go over the changes. Each time there was a change, they were pretty significant changes that impacted the visiting, the essential care visitor policies, staff, PPE use, that type of thing. So the visitor guidelines also were divided to support certain strategies for fully immunized visitors, and then different strategies for partially or non-immunized visitors or people who choose not to disclose their vaccination status. Surveillance testing was able to be reduced, and fully immunized individuals became exempt from the rapid antigen testing, and that was well received by most people. And I will just mention, though, that we continue to provide rapid testing on site. It's required for someone who chooses not to disclose or they're unvaccinated or partially vaccinated, but it's also available for staff if they wish to do a rapid test. And every now and then we do have staff say, you know what, I was in a place that there were lots of people around and I just would rather feel safe than sorry. And so some staff are still taking that opportunity for rapid testing. Infection prevention and control strategies continue to evolve as new information and guidelines come in. The Ministry of Long-Term Care also sent out to all long-term care homes a fall preparation checklist, and that allows us to do an audit of our preparation for potentially a wave 4, but also the potential upcoming influenza season. And so the long-term care homes are working their way through, or probably have already completed that now at this point, completed their assessments and are working on any areas for action. Regarding vaccination, we did release the policy and implement the policy that aligns with the Ministry of Long-Term Care directive effective July 1st. And as the directive at the time required 3 options for staff, volunteers, and students. That's either provide proof of vaccination, provide proof of a medical exemption, or complete an education program. And in our policy, the education program also requires a one-to-one discussion with a clinical leader. And so we have had now all of our staff successfully meet one of those 3 criteria. And in the report, you'll see our vaccination rates as of September 2nd. And for staff, the rates are 80%, 85%, and 90%. And we do continue to have individuals opt to become vaccinated. They've taken some time to learn and participate in the program, and so people still are taking that opportunity. We are in active discussions locally in the opportunity to align with our partners and require mandatory vaccination for all new hires. And this is something that we're working through and working through that decision. And I will be able to provide an update at the next meeting to update you on how that all rolls out. Also, at the end of August, long-term care homes received information from the Ministry of Long-Term Care related to the third dose of vaccination for long-term care residents. All residents of long-term care homes were eligible for a third dose at least 5 months following their second dose. And our teams worked closely with public health. And the last number I heard, we already had 225 residents vaccinated with their third dose out of our 316 residents. So we're well on our way to having all of the residents that are choosing to have that third dose to get them vaccinated. August marked our milestone for our designated care partner program. We celebrated the 1-year anniversary. It's kind of hard to believe. And to recognize the commitment and efforts over the past year, we dedicated August 23rd, the week of August 23rd, as Appreciation Week for our designated care partners. There's a link in the report that links you to an hour-long virtual event that was held on August 19th, where we recognized and appreciated the efforts of our DCPs. And 5 designated care partners shared their story, and it was a very moving hour, and it was very heartwarming to be able to share the stories back with staff. And we're continuing to look at how we can use some of that recording to give feedback and provide some support for staff. We also created a thank you video, and there's a link to that as well. And every designated care partner received a card and a little token of our appreciation. And it was a really wonderful event. In July, Kate Duchek and Christine Shepard are gerontologist consultants that offered pro bono to work with us to support a formal evaluation of our designated care partner program. They released the final evaluation report of the program, and there's a link to that report as well in this document, and I encourage you to have a look through it. The data collected from the experience surveys are highlighted and examine the perceptions and benefits of the program and how we can best support designated care partners during COVID-19 and also beyond into the future. And we're in the process of socializing that report. There's not a lot of formal evaluation of the care partner role in long-term care, and so it's really exciting to be a part of that work. Staffing. An update on staffing, the Essential Skills Supportive Care Micro Certificate Program. So that's a program, an introductory to healthcare program that's fully funded by the ministry. And it's a partnership between the YMCA, Georgian College, and Grey Bruce Long-Term Care Homes. It's going so well that additional sessions have been scheduled for September and October. Several of our care support assistants have completed this education and found it to be very beneficial. And we continue to include this educational opportunity at all stages of our recruitment. And it's really a great foundational piece of education to support someone who is considering long-term care or healthcare as a new career. And I think it's efforts well spent now to secure health human resources that are very scarce into the future. Gates College reached out to our organization regarding the tuition-free and paid placements for PSW students. And Melanie Boyd, our HR generalist, immediately reached out to our care support assistants, and 5 of our team members have taken advantage of this opportunity. So 5 CSAs have opted to further their education as PSWs. We're also working on a referral bonus program policy. It's currently under review to support the recruitment of candidates for the hard to recruit roles. And Grey Gables is planning to host a job fair in the coming months to promote the care community as well as the behavioral support transition unit. And we've had a few CSAs who are returning to Lee Manor as PSWs, which is also great, grow our own success. The other piece of staffing update I just want to highlight is we really benefited from a number of students that are RN or RPN students who worked as PSWs across all 3 long-term care homes. And we didn't want to miss the opportunity to learn from them. What was their experience? What would help them think about going into long-term care as opposed to working in emerge or in pediatrics or another specialty? And so we've included student exit surveys as part of our follow-up with students to get to hear from them and see what we can learn. There were a number of funding updates from the Ministry of Long-Term Care. So end of August, the government announced the extension to the temporary wage enhancement program for PSWs, extended to October 31st. There also was an announcement that there would be a 1.5% increase in the level of care-based funding for the 21-22 year. And that matches what we budgeted for that year. Additionally, there was more information around the COVID-19 funding and the prevention and containment efforts. So there's some one-time funding adjustments to support the shortfalls from April 2020 to March 2021. And then additionally, they announced the funding for September into 2022. And so the ministry anticipates that our prevention and containment expenses are going to decline over time. And this report highlights how that will wind down over the coming months. And then the report just highlights what that translates into for each long-term care home. We do continue to work with partnerships, both regionally and locally, regular partnership meetings as we sort out this stage of the pandemic. And we continue to be very thankful for the support of the CAO, the senior management team, our partners in Grey County, and council and committee. All of the attachments are linked there. Anything that I've mentioned are linked there, and happy to take any questions.
Thank you very much, Jennifer, for that comprehensive report, and certainly congratulations on behalf of the committee for the one-year anniversary for the Designated Care Partner Program. Are there questions from members of the committee? I'm not seeing any.
Yep, Warden
Oh,
Hicks.
sorry, Warden. Go ahead, Warden Hicks.
Thank you, Mr. Chair. I have to, not a question, well, maybe there's a question here, but mostly a comment. I'm really pleased to see the vaccine rate for our staff go up so significantly. I wonder if you might comment on why you believe that rate has increased, I think, markedly.
I might reach out to Dana for her opinion. I will just say that I think the education is an important piece, and the one-to-one meeting with a clinical leader. And it isn't a meeting with a hammer. It's a meeting with compassion and understanding, and to hear what the questions are and provide evidence-based responses. And I maybe just stole the answer that Dana was going to say, but Dana, did you have anything else that you'd like to add?
Well, I think that you've hit that, but there's also been some really unique initiatives at each of the care communities. They did posters asking staff, what is your reason to be vaccinated? And I think that's really recognizing that everybody has their own reasons for being vaccinated. Some of it is about family, some of it is about travel. Some, as things are evolving, but it's also about gaining information and understanding. And I think what we learned, the vaccine policy had the education component, and we wanted to offer those conversations. When you talk about vaccine hesitancy, it's recognizing what are the gaps, what are the challenges, how can we support as an employer filling in that gaps with information, and also facilitating. We do have a lot of women of reproductive age, and many of those were questions. So aligning ourselves with our local specialists, encouraging them to follow up and ask those questions. And then the other part is about access. So we reduced the barriers to access, and we had some EDs. I know I met Shannon in the parking lot with a few vaccines. And again, it's breaking down that barriers, especially when these are folks who are working 12-hour shifts. who then have to go home. And so there was a lot of creative work towards reducing barriers for our team and that commitment to the residents. So it's quite positive.
Thank you for that answer and congratulations. It's great to see that movement.
Any other questions from committee members? I don't have Councillor O'Leary in my screen. No, not seeing any questions. Okay, all in favor of the report? That is carried. Thank you. We now have report LTCR CM 2021 long-term care operational report from June 15th to August 14th, 2021 be received for information. Can I have a mover for that, please? Moved by Member Woodbury and seconded by?
I see Councillor O'Leary's hand.
And seconded by Councillor O'Leary. All right, Jennifer, are you starting off or are we going to the individual homes?
Sure. I'll just thank you, Mr. Chair. I'll just start. I think we're going to approach this in a similar way as before. The report was circulated ahead of time, and so we're going to hit the highlights. And I'll pass it over to Renata and Dena, who are going to touch on quality.
All right, thank you.
Thank you. Good morning. CIHI released the fourth quarter data, which is January to March of 2021, prior to this report. The data is starting to show the impacts of COVID, and you can see that through worsening activities of daily living, worsening mood from symptoms of depression, and falls. Dena and I, the clinical specialist, and I have started with regular department meetings and visits to the care communities. Through these meetings, we are looking at clinical data, and we are aiming for consistency and alignment with the 3 care communities. We've also started regular meetings with medical advisors where this data is also shared and discussed. Dena and I would be happy to answer any questions.
Thank you, Renata. Questions from the committee? All right, not seeing any.
Okay, and then Shannon.
Good morning, everybody. So under the Ministry of Long-Term Care Compliance Orders, Grey Gables hosted a ministry inspector from July 27th to the 29th. During the inspection, the compliance order for the head injury routine was put back into compliance, but we were also left with a compliance order related to air temperatures. We are now taking temperatures at the appropriate times during the day and making sure that we are hitting different rooms at different times. So we hopefully the next visit, they'll put that back into compliance as well. Rockwood Terrace also had an inspection during this report, but they had no compliance findings at this time. So that's good. And Lee Manor also had a visit as well, but they have not received the report for this.
Thank you, Shannon. Do members of the committee have any questions in regards to that update? Christine, go ahead.
Thank you, Mr. Chair, and good morning to everyone. Just wanted to double check, as I know we've got professional staff that are doing amazing work for long-term care communities. When the ministry inspector, ministry staff come in and identify where there is just an area of enhancement, is there a cross-reference with the other long-term care communities? So if it's an enhancement in Grey Gables, by way of example, whatever the matter is for enhancement, is that looked at along with the 2 other homes just to see if there's a double check or something else that could be improved? Or is it always that it's isolated to the one home? Thank you.
Shannon, are you taking that?
Well, I see Jennifer has her name up. I can, but
Okay,
I'll
no,
let
Jennifer, go
Jennifer.
ahead. Sorry, Jennifer, go
That's
ahead.
okay. No, well, we both, I'm sure we'll be saying the same thing. No, we absolutely want to learn from the experiences of our colleagues across the 3 homes. And so we have regularly set up meetings where we look at this type of thing, and then also informally, and with the support of Renata and Dana as the quality and clinical specialists, we use this information to make sure that we're meeting the expectations across all 3 care communities. Yeah, we definitely don't want to have the same findings and challenges that we just had at one of our other locations.
Great.
Thank you.
Dwight, go ahead.
Thank you, Jennifer, Mr. Chair. I watched a very alarming documentary, I believe it's W5, last couple of weeks on long-term care homes. And it was mainly in the GTA area where all these problems are, but man, it sure gives you a novel, bad feeling when you think about long-term care homes. We in Grey County are doing a fantastic job, but we're still painted with the same brush. And I don't know if anyone ever seen that documentary, but it was just totally shocking what you were seeing that's happened to human beings. And we're very blessed in Grey County to have the staff we have. But anyway, it was very alarming when you seen it.
You're absolutely right, Dwight. We are very fortunate to have the professional staff that we do in our long-term care, and our residents have been very well looked after. So, you know, certainly an appreciation for everything that's been done over the last year and a half. Do you want to comment, Jennifer, on that documentary?
No, no. I think appreciate the comments, and you know, those documentaries are also an opportunity for us to learn and to reflect and make sure that we're meeting the needs of the residents. And always in Grey County long-term care, the person-centered philosophy supports best practice, and that's something that we strive to do every day. And there's always an opportunity to make improvements. And so we experience these inspections and hear the feedback and then apply it across all 3 homes so that we can be making improvements. I think, Shannon, were you going to give an update on people and then pass it to Stacy and then Karen?
Yes.
Go ahead, Shannon.
All right, thank you. Grey Gables staff have come up with some pretty unique theme weeks and dress-up days during this reporting period in order to color it for our residents. We had a safari day where the staff dressed up as part of safari guides, and the residents, armed with their Nerf guns, went on a hunt through our gardens, shooting the lions, elephants, and cougars. We had a wedding week of shower games and bouquet toss and wedding pictures that the staff and the residents participated in, just trying to guess each other's wedding pictures. We had an antique car show that was a huge hit, especially because we had a founding member of the club that was a resident here. So he was very popular that day. The last week was a celebration of the 1950s with the music, karaoke, and we had an Elvis impersonator come in. So these theme days have really lifted the spirits of the residents and the staff during this time. So yeah, so we've been very fortunate, actually. I will pass it on to Stacy.
All right, thank you, Shannon. I'm sure the old deer hunters at Grey Gables enjoyed the safari.
Yes.
Stacy, go ahead.
Thank you, Mr. Chair. Good morning, everyone. I just wanted to highlight a really special Color It story for everyone, because it's going to be something that I think lasts here for a long time. And as Jen spoke to with the reduced restrictions during this reporting period, there was an opportunity with the increased vaccination rates that the province rolled back some of the restrictions. And this gave us the opportunity after almost a year and a half to resume communal dining. So knowing the many benefits of group dining that some of our folks have been missing out on, the socialization, the relationship building, increased food intake, all those things, the staff really embraced this opportunity and were eager to make this happen. So they immediately collaborated to ensure the transition was going to be seamless and welcoming for residents, because you need to keep in mind that for many of the residents, this was going to be an occasion of firsts. So some people were going to be entering the dining room for the very first time ever. Some were going to be meeting their table mates for the very first time. So as you can imagine, some were really eagerly awaiting this opportunity, while other residents were a little bit worried about those, the thought of going in to a new space and leaving the comfort of their own room and a routine that they were accustomed to. So staff kept this in mind and really prepared for this with intentional planning, as well as support and reassurance leading up to the day. But regardless of all of the pre-planning, I don't think anyone was prepared what actually happened on day one. And the mood was extraordinary, to say the least. It was very energetic, upbeat, so positive. Some of the dining rooms turned the music on and were dancing with residents and dancing them to their seats. In other dining rooms, after all the residents were seated, people just, it was very natural, just started applauding and cheering with excitement because they were just overwhelmed with joy. And another resident, it was so important to him because he had the opportunity to be one of the residents that was dining in the dining room throughout the period of restriction. And it was really important to him to stand at the front entrance and welcome every single resident and then follow up with a welcoming speech. He said, I didn't know this many people lived here and I'm worried we won't have enough food. But we did. And it was just a really joyful occasion. Some residents just made sure that they went to every single table, introduced themselves. Some were so nervous and people picked up on that energy and were able to say, just the sweetest things and just so many acts of kindness, like, don't worry, dear. I'm going to see you every day. We're going to get to know each other. It was truly overwhelming. It was, I think it was a real gift to witness the energy, the kindness, and the sense of community and belonging that was so evident from the day. Yeah, hugely uplifting. And I think it really symbolized a sense of normalcy and that we are making some progress on the road to recovery. And after a year of so much uncertainty and day-to-day challenges, I think that this was exactly what the doctor ordered for not only the residents, but our staff. So I wanted to share that with you because I think that this is a Colorado story that will not be forgotten here for a long time. So I wanted to share that. Thank you.
Well, thank you, Stacey. That's heartwarming. It really is indicative of how the small things can make a huge difference in a person's life. So thanks for sharing that.
Thank you.
Is there any questions from Lee Mann or from members of the committee? All right, I guess we'll go on to Karen now in Rockwood.
Good morning, everybody. Thank you,
Morning.
Chair. I just wanted to highlight the fact that our gang here really embraced the Summer Olympics this year. They enjoyed watching them on television. They had a tally board going that documented the Canadian medals and kept track of those. And then we topped it off with our own mini Olympics out in Pine Grove Garden. And there is a link there to the video if you haven't had a chance to look at it. Everyone really enjoyed the day. They had made some homemade medals and they were particularly proud if they received a medal and got to wear it, some of them even as long as to the supper table. So that was good. I just wanted to move over to environmental for a couple minutes and highlight a couple issues we've had here since our last report. We did have an odor of natural gas back in July, and upon some investigation, it was determined that one of the boilers was having incomplete combustion. And so some of this unburnt natural gas was being drawn back into the home. And during that time, it was also determined that the venting of these boilers was not adequate. Now, it has been like that for several years, but anyway, we have since fixed both situations. We replaced actually both boilers because they are the same age. And you didn't want to run into additional issues with the other boiler just in a short time. And they've also addressed the venting issue. So that has been put back into compliance. And with the big torrential downpour on August 7th, we incurred some flooding issues on the main floor here at Rockwood. It didn't affect any resident areas. Most of it was in the office area, a little bit in social services, and just a little bit near the auditorium, but because of the time of day, it didn't affect any resident services. As you can see in my Color It story, we had some very dedicated team members who, although their shift ended at 8 o'clock, they stayed till almost midnight to help with the cleanup. And we also had 2 members of the leadership team that came in to assist. So very appreciative of all their efforts. And also the fact that Mayor Robertson checked in on us just to make sure we were all okay. So anyway, with minimal disruption, everything was cleaned up and we're back to normal.
Thank you, Karen. Any questions from members of the committee? Christine, go ahead.
Thank you very much. And thank you one and all for the report. I'll start first with the flooding of that torrential rain that took place and the incredible work of Karen and your staff for just assisting residents and other staff in ensuring safety. With regard to that flooding, is there anything that as a committee we need to be aware of for recognizing we're doing a redevelopment, but is there anything we need to be aware of through budget for potential mitigation? And I do want to say thank you to everyone. The Color It stories on another topic, the Color It stories and the sharing of the events in the community in our long-term care homes just really amplifies how people enjoy working and living there. The communities just seem extremely outstanding, and I'm just very, very pleased with all of this. Thank you very much. Just a heartfelt thank you.
Thanks. Any other questions? Karen, do you want to speak to the question?
Yes, thank you, Mr. Chair. Just a comment about that. I think there was a design or something we could improve in the design, let's put it that way, of this home. Currently, all of the roof drains, and as you know, we have a flat roof, that water comes back through the building and out to the storm sewers. And that's the issue when we have rain like that. And this isn't the first time we've had flooding in those areas. They just simply can't keep up with that amount of water. So definitely something to make sure in the new build that it's addressed. To address it now in this building would take a lot of time and money. And I'm not sure that we necessarily need to go there, but definitely for the new building. And I'm sure with today's architecture that hopefully wouldn't happen again.
Thank you.
Any other questions from committee members? All right. All in favor of the report? That is carried. Thank you. We now have LTC RCM 2221 report regarding the Grey Gables optimizing PSW schedules be received, and that the shortfalls less than 7.5 hours at Grey Gables be extended to full shifts 7.5 for a period of October 1st to December 31st, 2021, and that the financial impact of $41,338.25 as phase 1 in the strategy to optimize staffing resources be funded from the Ministry of Long-Term Care COVID Containment and Prevention funding. Can I have a mover, please? Moved by Dwight and second by Warden Hicks. Jennifer, are you on deck? Go ahead, please.
I am. Thank you very much, Mr. Chair. And I would like to acknowledge Tallene Parkin, our Behavioral Support Transition Unit Coordinator or Project Coordinator for the preparation of and work behind this report. Tallene is unable to attend the meeting this morning, And so I will present on her behalf and thank her and the team for their efforts. So as you mentioned, you've read through the recommendation, and so I'll just provide some of the background. So the recommendation is extending the short shifts to full shifts for the remainder of the year from October 1st until December 31st. So as we know, because we've talked about this a lot, and it's very front of mind in the media, personal support workers are a critical health human resource and provide the significant portion of the daily care to meet the needs of our residents living in long-term care homes. And there's a critical shortage, and we need to be planning for today immediately and also be building plans for the days to come. Shifts that are less than 7.5 hours are very difficult to fill and recruit for. And Grey Gables has a handful of those short shifts in the PSW department, primarily because of the size of the home. It's a small home, 66 beds. And so historically, when there's been funding increases, it's per bed. And so it equates to a very small amount. And so we could add a half a shift or a short shift or 15 minutes every day to a short shift. And so this is how we end up in a situation where we have 4-hour shifts, 5-hour shifts, 4-hour and 45-minute shifts. And those shifts are very difficult to recruit for and very difficult to retain staff in, and very difficult to fill when there's a last minute call in. So you get a last minute call in, you're not really interested in coming out for 4 hours, 7, maybe 8. In order to optimize our abilities to recruit and retain staff, we are proposing the extension of the short shifts to the full 7.5 hour shifts. This adds 12 hours per day of direct resident care and creates 2 additional full-time positions. The annual cost of this would be just over $165,000, including benefits. Having all full shifts is a crucial step in creating schedules that are appealing and flexible to current potential employees. We feel it's important to make this change as soon as possible, as opposed to building it into a proposed budget starting into 2022, and that's why we're bringing the report today. Following this, if approved, the next step would be to work with the union partners, our frontline staff and human resources to create schedules that support that overall wellness for our staff and also meet the care needs of the residents. Following that, our plan is to work with outside stakeholders and partners to come up with models that would increase the number of full-time positions. Just as a note, the Ministry of Long-Term Care has committed to phasing in funding increases over the next 3 years to establish a care ratio of 4 hours of direct care. Direct care hours include registered nurses, registered practical nurses, and PSW, personal support worker hours. Currently, Grey Gables is at approximately 2.91 hours, and this change would increase it to 3.08 by including these additional PSW hours. Referenced a previous report from work that happened in 2018 and 2019, the Grey Long-Term Care Health Human Resource Task Force. We began the work of addressing the PSW shortages and unfilled shifts. The task force did need to take a slight pause in getting together and meeting and actively planning because of the pandemic. However, many of the recommendations from that task force have been implemented, and full shifts was one of those recommendations. So just to recap on the financial impact, the additional cost of the 1,000 hours for the period of October 1st to December 31st is just over $41,000, and we would propose that that be funded through the COVID prevention and containment funding. And Marcus and Joanna are here as well to help answer questions if there are any related to the funding implications.
All right, Jennifer, thanks for the report. Questions from committee members? John, go ahead.
Mine isn't really a question, more of a statement. I think what you're doing is great. I heard in the news there a couple of weeks ago that in Ontario we're short 27,000 PSWs. And when, people sometimes think it's a local thing of trying to get here. So I think these innovative ideas and working with your staff and the union and the community is the way to go about this. And we have the funding through the COVID funding. I say this is a great idea. Let's do this.
Any other thoughts? Jennifer, you mentioned that the Ministry of Long-Term Care is going to be phasing in over the next 3 years. Do we have any more details on how that phase-in may occur? And I guess my other question, if we're raising the number of personal support hours up to 3.08 at Grey Gables, what are the number of hours in our other two homes? Or how does that relate to the hours in our other two homes? Thanks.
Thank you, Mr. Chair. No, at this time, we don't have any formal information on what that phased in 3 hours would look like and how it would be, or even how it would be funded. The association we belong to, Advantage Ontario, is advocating to ensure that the funding is equitable across all long-term care homes and recognizes long-term care homes and organizations that are already at the 3, because that has been funded through other sources. And so there's some strong advocacy to ensure that that's recognized by the province. It's possible that Joanna or Marcus has the exact numbers for the other direct care. We have done that work, and I believe it's 2.95, 2.97, but I see Joanna popping up, and she may be able to provide the exact numbers.
Hi, Joanna.
Hi, good morning. Yes, so we're at 2.91 for Grey Gables. We're at 2.82 of hours of direct care per resident per day for Lee Manor and Rockwood.
Okay.
Great, thank you. And just as an aside, that as we are working on our 2022 budgets, that is modeling that we'll be doing to say, what would it cost to get us closer to 3? What would the budgetary impact be? Is it best as PSW hours? Is it a combination of PSW and RPN and RN? What does that look like? And that's the other challenge, committee, is that there's not, we're not sure that we're always comparing apples to apples. How are other organizations calculating the direct care hours? And that hasn't really been formalized by the Ministry of Long-Term Care either. Through Advantage, there's been an agreement that we look at RPN, RN, and PSW, but that's not been formalized by the Ministry of Long-Term Care.
Thanks, Jennifer. Jennifer, just one other follow-up question. We've been, there's been a lot of, staffing shortages, so we've had to rely on overtime. By taking this initiative, that should reduce the overtime hours that we're having to put out also, correct?
I think that that's a possibility. However, the challenge, the shortage is so complex in being a combination of not having enough staff available, the challenges that come with daycare challenges and some of the other factors that come with the pandemic. I don't want to guarantee that it will have that impact. I think that eventually down the road, all of these many strategies looking towards supporting staff wellness and the staff experience will eventually have that outcome. That is the goal. But at this point, I'm not certain when. I think it's a long time. We need to keep working and supporting and culminating the strategies.
Well, I think, your comment around eventually is what we wanted to hear, that our strategies were working towards that. I think that's good for everyone involved. So thank you for that report. Anything else from committee members in regards to this? All right, all in favor? That is carried. Thank you.
Sorry, Mr. Chairman, if I might.
Yes, Warren, go ahead.
One of the things, I'm looking back at that task force report in 2019, and one of the items that we were hoping to address was scheduling, because one of the things that came out of the survey was people were seeking a work and life balance. Is this going to address that?
Thank you. Sorry,
Okay.
thank you, Mr. Chair. If I might, excellent question, Warden Hickson. Thank you for asking it. We believe that this is the first step in optimizing schedules. And when we talk about optimizing schedules, we don't mean just to ensure that we have every spot filled to cover the floor. When we talk about optimizing schedules, we mean a schedule that supports resident care, but also is consistent and predictable and meets the preferences of the people working that schedule. And so we believe that the first, logistically, short shifts are very challenging to build into full-time lines or reduce full-time lines that someone might find appealing. And so, yes, we feel that this is the first step in moving towards that process.
Yes, and Mr. Chairman, I think that when you're talking about a work-life balance, if you're having to piece together two places for a full-time, income, which is obviously needed, that work-life balance begins to take a nosedive, because there's a travel and that I guess that stress of constantly trying to make that work. I come from a background of immigrants who are constantly doing just that. And they say, "Man, I got two jobs, man," and they sort of wear that as a badge of pride. But after a while, it takes its toll on them.
And
Jennifer?
if I might, the pandemic has really heightened the awareness of the responsibilities and stresses on everyone's lives. Balancing kids at school or family members that people are supporting, plus their work. And I think if we're going to look for a silver lining, it's a good kind of kick to say we need to be paying attention to what causes stress in people's lives, and we need to start mitigating it. Because if we don't, the crisis is just going to get worse. We are, I don't know if I shared at a previous meeting, there was a report partnership between City of Toronto Long-Term Care and the University of Toronto Mechanical Engineering Department. And they did a collaboration working together to problem solve some of the challenges around scheduling. And the paper is really excellent. I'll circulate it for any of you that are interested. And we have done some preliminary reach out to the U of T Department of Mechanical Engineering, and they're interested in working with us to support some of the problem solving and the logistical challenges that we face in optimizing people's schedules. And I think you're very right. We need to be listening to our staff to define what work-life balance is, and we need to appreciate that work-life balance has some fluidity and it's different for different people, and we need to build that into how we run a 24/7 operation.
Thank you. Is there anything else before we continue on? Not seeing anything. All right, thank you. All right, we now have a closed.
Sorry, Mr. Chair, we do need to, did we vote on it?
I thought we voted.
Did we? Okay, sorry.
And it was carried.
Thank you.
Okay, we now have a closed meeting matter. We have a motion that the Committee of Management does now go into closed session pursuant to section 239 sub 2 of the Municipal Act 2001 as amended to discuss personal matters about an identifiable individual, including municipal and local board employees and labor relations or employee negotiations. Can I have a mover, please, to go into closed? Moved by John and seconded by Christine. All in favor? That is carried. Who, Jennifer, do you want to remain? Or Kim, who's remaining for this?
I don't know that it's necessary to exclude anyone at this time. Jennifer, would you agree?
I agree with that.
Okay. All right, we are now in closed session.
We will
And,
take one moment to pause to remove from the live stream. So
Okay.
I will let you know when closed session can continue.